Hi, my name is Laura.Patrick. I'm our clinical neuro program manager for Advent Health Sports Medicine and Rehab. I've been a neurological physical therapist for 12 years, and I'm also a board certified neurological specialist. My poster that I'm presenting today is about comparing pre and post physical therapy core outcomes after implementation of high intensity gait training for chronic CVAs, incomplete spinal cord injuries, and traumatic brain injuries. The purpose of our project was to retrospectively compare patient outcomes from pre and post implementation of high intensity gait training. So what we did within our system is we had 2 pilot clinics where we really utilize that knowledge to action framework, which you see at the bottom of the poster here, to help to implement high intensity gait training. We set up, what does high intensity gait training look like in terms of how do you know you're successfully doing it? So we looked to the research to find out what were they doing within implementation projects within the research to successfully meet high intensity gait training. And we came up with what we kind of called our compliance or our goal for implementing high intensity gait training. So that includes spending at least 20 minutes of our 1-hour treatment sessions at that 70 to 85% of the patient's max heart rate, or 14 to 17 out of 20 on the RPE scale. We then looked at our usual care of our patients. So we captured a cohort of 22 patients, and we did a manual chart review of how are we doing with those patients with usual care prior to implementing high intensity gait training, and then compared that to post implementation. So I'm going to talk you through the table at the top of the poster here. So prior to implementing high intensity gait training, patients, depending on their diagnosis and their MDC for their diagnosis, they were meeting the 10-meter walk MDC 53% of the time. For the 6-minute walk test, we were not implementing that, which makes me a little sad that we were underdosing our patients. And it took us 15 sessions to hit the MDC based on their diagnosis. Post implementation, we were meeting the 10-meter walk 75% of the time, which is a huge change in those patients' outcomes, and definitely a huge change to their quality of life as well. And then from the 6-minute walk test, we were meeting the MDC almost 72% of the time. And it took us 12 sessions to do that, to hit the MDC, which is really impactful. And then our success rate there was 62% of the time. So what I mean by that is that 62% of the sessions that we were working with our patients, we were hitting that 20 minutes of your heart rate zone or your target RPE zone. Our goal for our project was to do that during 70% of the session. So I feel like we did pretty well with that. So moving forward from our system, we implemented this at 2 of our clinics. We're trying to work on giving a system-wide push out to our 11 outpatient clinics and trying to increase our success rate and our compliance with implementing high intensity gait training. So that way we can see a shift in our outcomes. For you all observing this or looking at the poster here, what I would really kind of call out is utilizing this knowledge to action framework to implement high intensity gait training is feasible, and setting a goal for your system like we did helped us know that we were successfully doing that. So that way we could really see a change in our outcomes. Thank you.